My name is Mary Jo Power, and my injury happened December 26th. I was working after Christmas in 2018, and luckily I work in a hospital, so when I fell, everyone was right there. I got really good care. So that part was great. When it kind of fell apart was working with workers' comp, and not only being injured, not being able to walk, having people take care of me, that was extremely difficult. Feeling stupid, what I had done, just all those feelings that were just making me feel worse and worse inside, as well as, just dealing with the injury. So workers' comp is like a factory. You feel like you're an assembly line when you start seeing a workers' comp doctor. To me, anyway, I felt that they looked at you like an injury and they lost track of the person. And when I was referred to IPM and to see Dr. Abachi, Dr. Abachi was the first doctor who acknowledged the emotional side of all of this craziness. And I broke down in front of him, like I'm almost going to do now, because it was so emotional. So that was the treatment part. And then the aftercare part, I was wondering what it would be like to spend 8 weeks in a class. And at this point, it was under quarantine, especially on his little Zoom thing. And so I had a lot of hesitancies about that. What could I learn in 8 weeks? Who would I be with? What would it be like to learn all these things when I was feeling so sad? But 8 weeks later, it was wonderful. It was such a great experience. And to this day, I look back on what I learned during the time. Physical therapy was pointed toward us as our injury, but it also looked at us as a person. So we were exercising every part of our body, and we were on our own program. We didn't need to strain or stress. The instructors were wonderful. Wellness, which was a little new to me, as far as mindfulness and kind of going inside to just tame it all down. A lot of the education part was so important. It focused on how your body reacts to an injury and how it changes your brain. And that's what Dr. Abachi said to me at the first interview, was about a pain brain. And it was so important to know that this wasn't all me, that there was a reason that I was so crazy and depressed and upset, mad at myself, angry at the world. There was a reason for that. It's because my body had taken over and was taking care of itself. Art therapy, to me, was the most encouraging. I am not an artist. I don't consider myself anything artistic or anything putting things together like that. So I was a little hesitant, like, art therapy? Anyway, the instructor, Christine, is so kind and patient. You don't have to be an artist. The most breakthrough part of it for me was the mask exercise. And it was about 3 sessions that we were focusing on what our feelings are. She's also a therapist, so she's an art therapist. What your insides are versus what your outsides are. My insides were all jumbled up, angry, mad, upset. What am I going to do? How am I going to do it? Just crazed from my perspective. My outside, because I never like to appear at all like that at all, my outside was just a plain mask. Mascaraed eyes, lipstick, just a normal looking person. And you flip it over to the inside, and it had all these black and dark blues. Because I'm not an artist, I looked at the Edvard Munch Scream. That's what I thought about. So I tried to depict that, and it turned out okay. I just had not realized that I was that way on the inside and I needed to address it, or even that I was that upset on the inside. I certainly felt that way, but to see it in an image really changed how I looked at my injury. So to people who are listening to this and who are a little bit hesitant to maybe think about what they can do in 8 weeks, because it's a lot of time, it really helps you deal with what is a life-changing injury. Everyone is kind. Everybody is so supportive. Not only the staff, but the aftercare program. Everyone in the program has experienced this kind of event. So they are so supportive when you're having a flare-up, when you're having something that it's difficult to deal with and you're not quite sure. I was, again, doing all of this on Zoom. So I can't imagine, and I certainly look forward to doing this in person, because even on Zoom, you just saw faces, you just saw heads. But I feel like I know these people, and they're my friends. We're also on text. It's not overwhelming, it's just very supportive and very individual and very kind. That's my experience.